Hey guys! Today we're going to be talking about the junior doctor strikes, and this is a really important topic if you're going for medical school interviews.
Here are the main points. Following recommendations made by the DDRB, the government decided to create a new contract. And this contract was debated amongst doctors, and the BMA got involved, so let's find out why. The BMA said that they urge the government not to impose a contract that's unsafe, and they'll resist a contract that's bad for patients, junior doctors and the NHS. And the government said that they want to improve patient safety, and the current contract is unfair for doctors and patients, and they need to discuss a way forward with the BMA that maintains earnings for junior doctors.
Why did the DDRB recommend these changes? Well, firstly, they considered these factors. They need to recruit and retain and motivate doctors and dentists. They need to consider the funding for the NHS. And they need to consider variations in the labour markets and effects on recruitment and retention of doctors and dentists. They also use this criteria for guiding their recommendations: affordability, improved patient care, appropriate remuneration, maintaining respect and trust for consultants and junior doctors, credibility and practicality of local implementation, and to help facilitate constructive continuing relationships.
This is what was involved in the old contract. Junior doctors were paid a standard rate for shifts from 7 a.m. to 7 p.m, Monday to Friday, and they were required to do on-call shifts outside of these hours. In this way, they earned more through a process called banding, and depending on what type of doctor they were, some of them could make more through banding. And their salary per year was decided by their grade, for example, starting with Foundation 1, earning a minimum of £22,636 per year.
This is the new contract, and there are other points other than these, but these are the main points. So the hours are now 7 a.m. to 10 p.m, Monday to Saturday, and there is now a new process called nodal pay, and the salaries for each doctor is now arranged differently into these nodes, and these are the new salaries instead of these ones which you saw before in the previous section. And now unsocial hours are recorded through exception reporting, which is here. And the process is quite complex. So this is basically a summary of how it was before, so that's banding, and how it is now. And so yeah, that's how it's recorded now. Okay, so next bit, there is now whistleblowing. So it was common for doctors to be dismissed as a result of whistleblowing, but now there is protection against unfair dismissal. And there are now guardians of safe working, which is each hospital must have a member of staff to guide junior doctors.
About this new contract. Well, working 7 a.m. to 10 p.m. may increase stress and tiredness of the junior doctors. Also, in maternity leave, pay progression is halted. And this affects those who wish to change speciality. As before, salary was protected if a doctor switched, but now you'd have to start at the bottom of the pay scale. The removal of GP registrar supplement could be important due to GP shortages, and this may also discourage doctors from working in specialities with many unsociable hours.
What happened as a result of this new contract? 98% of junior doctors were in favour of rejecting the contract in November 2015. And then there were strikes through January to March of 2016. Dispute between the BMA and the Department of Health continues, and half of doctors who finished foundation training in 2016 went into NHS training, which is a 21% decline in 5 years. However, the government has created 1,500 additional medical student placements each year, and this just shows public view on this matter. I understand that this is quite a difficult topic to talk about, so if you have any questions, just comment below.
And we hope this was helpful for your interview preparation. Thanks for watching! Bye.